about fair and reasonable and sustainable rates of pay and allowances for student nurses and midwives. I first raised this issue with you on the floor of the Dáil in July of this year. I raised it again with you in September, in October and November, and as you know, others in this chamber raised this issue as well and brought forward a private member's motion, which your party and your colleagues in government voted down and voted against. And I want to say from the outset, Minister, so there is absolutely no confusion whatsoever, that my party is not seeking to change the current model of education and training for student nurses and midwives. It's a model that serves us well. And in my view, we turn out some of the best and most hard-working students, nurses and midwives, which are the envy of the world. The problem, Minister, is that they don't feel respected and they don't feel valued. I've engaged, Minister, with hundreds of student nurses and midwives over the last number of months. And I've listened at first hand to what they are telling me. And they understand, Minister, so you are very clear, that there is an element of training and education and supervision to their placements. But they also understand and know, and I think you know this, that when they step onto a hospital ward, there is also a strong element of work. And they are doing real work. And they want that to be respected. And they want that to be valued. And they want you, as Minister, to put fair and reasonable solutions on the table. And what you put on the table, Minister, so far is completely unacceptable. €100 a week of an allowance for first, second and third years was quite rightly seen as a slap in the face and far from adequate, not fair and not reasonable. And contrast that approach, Minister, with the approach that you took for the most senior civil servant in your department, when you sat down with two of your ministerial colleagues and you hatched out a plan to pay that individual, when the post becomes permanent, a pay rise of €81,000, not a salary of €81,000, a pay rise of €81,000, to bring that salary close to €300,000 a year. How can you, Minister, sit there and say that that's fair and that's reasonable? And that's you valuing the work that those on the front line do in our hospitals. And that's you, as a Minister, valuing the work that student nurses and midwives do. How is that fair? And student nurses and midwives are looking at this, as are others, and are saying that what you did over the last number of months is prioritise that individual over the needs of thousands of those student nurses and midwives who have done such huge work and Trojan work in our hospitals since this pandemic struck. I want, Minister, to outline to you some of the experiences which have been recounted to me by those student nurses and midwives. One said, "I was diagnosed with COVID-19 during my placement. I had to put my entire family at risk because of the work that I do. For all of that, I got nothing. An allowance of €50 per week and a travel allowance of 25 cents a mile paid 2 months after placement finished. Or if you live close by, nothing at all." Another one, "It is 10 months since I got COVID while working for free, and I'm still not better. I will either emigrate or return to college because it is not worth working as a nurse in this country." Now, I want you to listen to those words, Minister, because this is why this motion is so important. If we don't value the work that student nurses and midwives do, they will leave. And we are putting them through what I said earlier to be one of the best training and education programs in the world. And yet they are leaving in droves because they are telling me they don't feel valued and respected by you and your government. So can I say to you, Minister, directly, and can I make this point to you? This is an issue that should not divide us. This is an issue that this House should be united on. That we do what is right. That we right a wrong here. That we make sure that we pay student nurses and midwives reasonable and fair rates of pay and allowances. That's all they're looking for. So I'm calling on you, Minister, to support this motion. I'm calling on you to do what is right. I'm calling on you to send a powerful message to those student nurses and midwives that we want them to stay here working in the Irish healthcare system, not emigrating, and that we value the work that they are doing on a daily basis. So please, Minister, listen and act and support this motion. Gurv Margaret.
Thank you, Deputy Cullinan. There's just over 14 minutes left now with 5 speakers. Deputy Mark Ward.
Minister, it's time to pay student nurses and midwives now. €100 is an absolute insult to the hard work put in by student nurses on the front line. Student nurses and midwives did not go into hiding when they were called upon. They have put themselves at daily risk for the common good. They have gone above and beyond what they've been asked to do. These students worked. They were needed to work, and they should be paid. It's as simple as that, Minister. The €100 that this government offered will not cover transport, it will not cover lunches, it will not cover childcare, and it's an insight into how this government values our student workers, because workers is what they are. Now, as David Cullinan just said there, no wonder so many are leaving our shores once they become qualified. This is about fairness, and €100 is an insult and just won't cut it. The decision to pay student nurses and midwives lies with yourself, Minister, but Minister Simon Harris also is responsible in protecting students from exploitation. So yourself and Minister Harris need to step up to the plate and pay students, nurses and midwives now. There should be no more empty promises. There should be no more delays. If my colleague David Cullinan was Minister for Health, I have no doubt he would pay student nurses and midwives now. The decision to suspend placements for student nurses is just another attempt to kick this issue down the road and muddy the waters. I've spoken to students in my own area in Dublin Midwest, and they tell me that suspending student placements does not make sense during a staffing crisis. This motion also includes students who are performing essential pandemic-related work in hospital settings. And I mentioned student radiographers. These are the words of a student radiographer to me. Every student radiographer, while on placement, has been face-to-face with COVID patients from day one. The first thing a COVID patient gets done when admitted to hospital is to get a chest X-ray. Our student radiographers every day go into COVID ICU, taking X-rays. They also take CT scans, and they often assist in positioning in ICU if their assistance is required. We believe that any student performing pandemic-related work in hospitals during COVID-19 should be paid appropriately. Minister, the initial review commissioned by the Minister, by yourself, not only falls short of the expectations and needs of student midwives, but you also chose not to examine the circumstances of other students who work in hospitals. So, Minister, we need to pay these students now. We need to pay these student workers now. We need to do it without delay, and we need to stop making excuses and get on with the job. Good morning.
Thanks, Lascian Corla. Minister, I want to start off by saying that I would urge all deputies in this chamber to support this motion and to actually, for once, put their money where their mouth is. You know, student nurses and midwives, along with everybody else that works in the health service, don't want us standing up here clapping. It's actually an insult to them. It's patronising and it's demeaning. What they actually want is fairness and they want respect. The situation was never good in our hospitals for the last number of years, and that's due to the underinvestment of not only this government but previous governments. It's obviously gotten an awful lot worse, and all of us are aware of that since COVID. And for me and for our colleagues in Sinn Féin, this is a very easy and a straightforward decision. As I said, it's about fairness and respect, and €100 is an insult and it just won't cut it. Where students are needed to work, they should be paid. And the decision not only lies with you, but there is a responsibility on Minister Harris, who ironically was the Minister for Health before you, so him of all people should know about this situation and should be well aware of it. We can't see any more empty promises or delays in relation to this, or in relation to anything, I would say. I'd take the opportunity to make the point in relation to the health service. The staff are exhausted and they're at breaking point, if not gone past that. If our own colleague, Deputy David Cullinan, was the Minister, he would ensure that student nurses and midwives were paid. It's a reality that our hospitals were understaffed far before the pandemic, and we simply could not function without the valuable work that the student nurses and midwives do. Nobody wants to put students at risk, but the government has been failing to invest in health, failing to have enough staff, and failing to keep this virus under control as a result. Throughout the pandemic, student nurses and midwives have been working bravely and tirelessly every day to protect our families and communities from COVID-19. And I'll finish because we're tight on time, but just to say that people are sick of talk and promises and, oh, we all have sympathy and empathy with you. They really want to see action. So for once, I would appeal to you to please ensure to do the right thing.
Thank you, Deputy Carthy.
The strength of our response to COVID-19 has been the concept of solidarity. It's a concept we've seen in every single community across this country, but it's a concept that appears alien to government. So we're in a situation now where Deputy David Cullinan has to bring a motion before this House, the second motion relating to the demand and the request and the plea that student nurses would get paid for the work that they do. That we should be even discussing this motion at all is incredibly disappointing. But that we should be discussing it in a week when government are defending their decision to increase the salary of the Secretary-General of the Department of Health to €292,000 per annum shows how perverse government thinking is. The proposed salary for Robert Watt marks an increase of €81,000 Can Corla of an increase. €81,000 is more than front-line workers get paid in totality. So compare that with the offer that apparently has been made to student nurses, €100 per week for the work that they do, after all the testimonies we've heard, after all the realities that they have spelt out to us. €100 per week, Minister, it's insulting, it's patronising, and it sums up this government. And then people will wonder why it is that our newly qualified nurses are found in every corner of the world, why they're treasured by almost every other health service in the world. It boils down to one thing, Lascan Corla, it boils down to lack of respect. Minister Donnelly defended the proposed increase in Robert Watt's pay in salary from €81,000 by €81,000 to €292,000 per annum. And his logic is incredibly interesting. He says that this pay hike is as recognition of the unique challenges and very significant responsibilities attached to this role. That spells it. That sets it out in the clearest possible term. This government, the Minister and the leader of Fianna Fáil and the leader of Fine Gael and the leader of the Green Party recognise the unique challenges and very significant responsibilities of bureaucrats and officials, but they don't recognise the unique challenges and significant responsibilities that have been undertaken by the front line of the front line, our student nurses and midwives. I commend this motion to the House. I commend David Cullinan to bring it, and I beg and plead every member of this House to stand by those who have stood by